None of us like rejection, but what happens when the rejection or perceived failure triggers severe emotional pain? According to the Cleveland Clinic, this condition, called Rejection Sensitive Dysphoria, or RSD, is often linked with ADHD, can be due to differences in brain structure, and makes it difficult for your brain to regulate rejection-related emotions behavior, escalating the resultant impact far beyond the norm. Today's guest, Tim Kettenring, brings a unique perspective to this discussion. He has shared very publicly about his struggles with the condition while also being a respected expert in training high-performance athletes. Our discussion will bridge the gap between the two, what he's discovered that may be helpful to others, and we'll also pick his brain about one of your favorite topics, human performance. Thanks for spending a few minutes of your week with us here on the Catalyst 360 podcast, your source for engaging evidence-based health, wellness, and performance insights. I'm your host, Dr. Brad Cooper, CEO of Catalyst Coaching 360, and Tim and I connected offline after he shared about his personal struggles, as I thought it might be helpful to many, either you as our listeners or people you know, if he were willing to discuss it further. We decided to hit the pause button for a few months, and then he recently reached back out to me to say, I'm ready. And that led to today's discussion. Speaking of discussions, if you're an employer, EAP, or wellness service provider looking to integrate real conversations with nationally board certified coaches for the employee team members you serve, Catalyst Coaching 360 might be the solution you've been seeking. Now in our 18th year of providing the very best in health, wellness, and high-performance coaching for organizations nationwide, we offer you an alternative to the generic call center-based coaching with low participation and even lower engagement. If you're looking to create lasting, meaningful, and positive change for those you serve, maybe it's time for a catalyst. Contact us anytime, results@catalystcoaching360.com, or visit the website catalystcoaching360.com, and we'll help you create an effective roadmap going forward. And now it's time to listen in with Tim Kettenring on the latest episode of the Catalyst 360 podcast. Tim, really appreciate it. We talked a little bit offline. This is a tough one. I mean, you're this all-star. You're this guy working with the high performers, and yet you've publicly shared these struggles. So thank you for your willingness to be transparent, that authenticity, it's just so important right now. So thank you.
I appreciate you having me, Brad, and I appreciate you sharing those sentiments with me as well.
Let's jump right in. Let's lay out this rejection sensitive dysphoria that I had never heard of before. And then we're talking about it over the Thanksgiving table. We had some friends over with family. One of them said, "That's me." I'm like, what? So I think both from our conversations offline and that happening, this is far more common than we realize. Tell us a little bit about this. How did you discover it in yourself? Yeah, just walk us through the basics.
So rejection sensitive dysphoria, or RSD, is probably the most significant symptom of attention deficit hyperactivity disorder.
Really?
So ADHD is probably super commonly misunderstood as kind of like the inattentive type. Mm-hmm. But essentially it's just an executive dysfunction, and from a lack of dopamine production in the brain. So it's a lot of times presents in childhood with your typical, hyperactive little boy or hyper-focused little girl. And then obviously like progresses most commonly into adulthood for most people who are diagnosed as children. And I was not diagnosed actually until I was 38.
Oh, wow.
Despite my wife, who's a psychologist, actually probably around the time we got married 11 years ago, she asked if I had ever been tested for ADHD. And I was like, no, I just kind of knew that was something that affected me, but didn't really understand just how deeply. And so I just kind of ignored it until a series of events kind of led my therapist to ask, is this something that maybe we should look into more deeply? I said, yeah, let's go ahead and talk about it a little bit. And so we did an assessment and combined type, which is basically hyperactive and inattentive. So it's the worst of both worlds. which obviously from a professional and academic standpoint makes a lot of my struggles in school and then as a professional adapting to those kinds of environments make a lot more sense. But then when I started to dig in more to the emotional dysregulation piece, so that rejection sensitive dysphoria, the RSD, there's a lot of similarities with personality disorders. Sometimes it's even misdiagnosed acutely, like in a clinical setting, as bipolar. It's also misdiagnosed as like major depressive disorder. There's a lot of overlap between personality disorders and RSD, but when you look at it over the long term, what sets RSD apart from personality disorders is that it's very, very short term. So like, for example, if I'm experiencing an RSD episode, it may be an hour, it may be a couple of days. And then obviously like, that has various components like within that time frame. Some of it could be, extreme anxiety. Some of it could be, deep depression. But the differentiation is that, or at least from a clinical standpoint, is that it doesn't last for an extended period of time, thus can't be diagnosed as bipolar, major depressive disorder, anxiety, depression, generalized, et cetera, et cetera. But from my perspective, kind of reflecting back on my life and a lot of my challenges, again, academically, professionally, but then also like in relationships and friendships, and that runs the gamut from friendships, relationships with my parents, romantic relationships with my coaches as an athlete, relationships with colleagues, have always been a struggle, because anytime I felt the slightest hint of criticism or any type of negative affect, it was like immediate.
Wow.
And so it affected obviously like how I interacted with everybody, but then it also affected any perception that I had of, and it could have been constructive, but there was almost no chance that I was going to take it as such.
Oh, wow. A lot in there. Let's lean back into the ADHD piece of it. Do you see those as separate? Do you see them as same? Like when I say let's lean into that, are you saying, well, Brad, you can't? Like it's the same. It's too interconnected, or are you able to address this over here and this over here, knowing they influence one another?
So they really, I perceive them as being completely different. And especially so the way that I like treat my inattentiveness or my hyperactivity is through mindfulness meditation, like true, like Zen, like a Zen practice, and through therapy. And then I take 20 milligram extended release Adderall daily. And generally the combination of those things will help with my ability to focus. And then, building practical organizational systems in place, understanding that I have to have a million different to-do lists and that I have to have a really structured way to organize those to-do lists. Those are all like kind of the cognitive, like true executive function strategies that I have to use in addition to obviously medication. For the kind of the emotional dysregulation side, because it does present as anxiety and depression, there's obviously a therapeutic component to that as well. But really it's being able to, or trying to create some sort of space between whatever the stimulus is and then whatever my emotional response is, which obviously like mindfulness meditation will help with that over time. but ultimately, like it does come down to like there's a neurobiological, issue, a challenge that I have that, and everyone with ADHD has, and that because there isn't sufficient dopamine production, there is no space between stimulus and response. So it's like, the Viktor Frankl quote, right. It applies to most people, but it doesn't necessarily apply to us with ADHD. So, there are a couple of medications, clonidine and guanfacine, both of which are alpha agonists for hypertension. And I take a low dose 2 milligram guanfacine, and that helps significantly delay that response. And obviously, combined with really trying to create space myself when there is an incident, and incident doesn't necessarily, again, mean anything negative. It's just there could be something that I would normally perceive as falling under the umbrella of RSD, whether it's constructive criticism or otherwise, or something as simple as I didn't put the grill cover on and my wife got mad at me, which is totally understandable, and yet it could bring me to tears. So, but being able to obviously like have a little bit of a buffer and then start working on the cognitive piece of, okay, I didn't do what I was supposed to do. My wife is upset with me. I deserve that. And it's okay. Like, doesn't mean I necessarily have to like the world is ending and I am totally worthless.
Right. I love how you've taken, it sounds to me like a 360-degree approach to this. You haven't said, oh, I just need to exercise more and that'll fix it. Or I just need to meditate more. Like, it sounds to me like you're addressing all the medical side, the physical side, the meditation side, the rational side. Has it always been that way? Or did you have, I've had people call it ADHD denial, where it's like, no, it's just me. Like, that's just how I'm made. I love being me. I'm not getting on meds because that's going to mess up who I am. Like, was there any of that early on? Do you have friends that you would use that phrase with? Like, talk us through that component, because it seems like that's a common element, especially with something like ADHD.
I haven't really thought about it that much, to be honest with you. I think so. ADHD is obviously like highly heritable as well. And there's no doubt both of my parents have ADHD undiagnosed, and kind of glossed over it when I shared that with them. Oh yeah, we knew, we're ADHD too. But I don't think they really understand that. Again, it's more of that classical, like, or either inattentive or lack of ability to focus. But it's, you use the term comprehensive, like it really is. It's a comprehensive, very complex disorder. And so being in the profession that I'm in, so like it's like I'm a high performance director for a professional rugby club. And what that means is that I have to facilitate the integration between every part of our organization, from the rugby staff to the medical staff to strength and conditioning to sports science to the players themselves to management, and make sure that all stakeholders are as selflessly involved in the decision-making process as possible, so that ultimately we can achieve peak performance on the field. So that kind of approach to complex issues and challenges that ADHD presents just kind of makes more sense to me. But then the more that I read on it, that seems to be kind of the best approach for all the reasons, really, because it does create so many different challenges from a lifestyle and productivity and relationship standpoint.
So you don't, let me put words in your mouth here, but what I'm hearing you say is, if there's somebody out there that's saying, yeah, that kind of sounds like me, or I've been diagnosed, but I've kind of been holding back, you would say, stop screwing around. You can be a better version of you if you'll try this comprehensive approach? Am I hearing you right? Or at least for yourself, that's what you've seen is you haven't become less of you. You become a better version of you that allows you to come out because you've addressed these gaps.
Right. Yeah. I mean, because like when you think about neurodiversity, just as a concept, obviously it's kind of a laterality of thinking, and in that, and in some ways, like ADHD is kind of a cognitive superpower, because when you can harness it, many of us like have IQs 1, 2, 3 standard deviations above the mean. So when you do have the ability to take control of that potential, it really is like a superpower. But if you never create the systems or the supports or have medication, some sort of medical protocol in place to be able to do that, then you really are only going to be able to harness it in bits and pieces or at certain times.
Yeah, well said. Oh, man, there's so many different directions we can go. Let's start with this. How does RSD, again, folks, it's rejection sensitive dysphoria, impact individuals in their personal and professional lives? And you've talked about the coping strategies, but is there anything else that maybe you've tried, hasn't been a thing that you've adopted, or something you're looking at adding in the future? Is there anything else that we haven't covered here in your initial kind of, this is where I'm at, Brad, this is what I've been doing, that you want to just throw out there on the table for us?
It's all kind of new to me. I mean, this has all kind of happened within the last year. So
interesting.
I'm kind of not totally in the dark, because I have done a good bit of research, and obviously like just being in therapy is super helpful.
Yeah.
But a lot of it for me is like, comes down to understanding, here are my specific, subset of challenges and how RSD affects me. Now, here are maybe some potential solutions. Okay. Trial and error. This worked well in this situation. Maybe this didn't. I think the one thing that I probably haven't done enough of a job of, like a good enough job of, is just being really patient in those situations, because whatever particular emotion that, that RSD episode may have evoked is usually so intense that it seems like, so like dysphoria in Greek is unbearable, like means unbearable. And that's really what a lot of the anxiety and if it presents as depression really feels like in an RSD episode. So it's kind of, once I get out of it, I kind of have to reflect back. Maybe there's some journaling, maybe there's, some discussion in therapy about maybe what I can do to manage the next episode, or if it's kind of a recurring thing. So like performance reviews, for example, nightmares. So you can imagine.
I can imagine. Oh my gosh. I didn't even think about that. Yeah.
It's like for 6 years, I worked I was an assistant athletic director and a head of strength and conditioning at a small university in New Orleans where I live. And I mean, I think we did semi-annual. So every 6 months we get a performance review with my boss, who I enjoyed, working with for the most part. But, there was always like so there'd be the typical, like, ADHD things. So like I would never, like task orientation, task initiation, motivation, sometimes like all of those affected my ability to do my job. But then when it came time for performance reviews, for the most part, like I would do okay, because the coaching component of my job I did really well. It was the administrative component of my job that didn't do well. But then when it came to review time, of course, it was, I perceived it as a bloodbath, even though it was like, yeah, you're doing pretty good.
Right. Well, and I think everybody relates to that on a minuscule level. They always say you come out of it with, there were 20 good things and 2 that you could work on. You're like, oh, I'm a disaster. I'm terrible. But you're saying it's not, it's like to the 100th degree.
Absolutely. It's like the 20 good things didn't even exist.
Yeah. You mentioned the short-term piece with RSD, and you said it could be an hour, it could be a day. Is that part of your strategy, knowing this is going to flip in a day, this is going to flip in a week? Or is it so all over the place from an hour to 3 weeks that's not really helpful?
Because there obviously like there's a neurochemical component. It's never going to be more than a couple of days.
Okay.
There will be some ebb and flow past that period of time, but generally like 2 to 3 days is about the longest. And obviously like the initial onset is the most intense. So trying to see past that is the biggest challenge. And for me, I just kind of try to, even though it's obviously still a challenge, to just remind myself like this is temporary. Eventually this is going to abate. You know, I'm going to survive, first of all. And second of all, like there is an end in sight, even though I don't necessarily see that end.
But the rational, I mean, part of this is the rational can't win in the short term because we're in the midst of this.
Right.
And so you're using it as a little bit of a buffer, but the fact is, even saying, I know I'm going to be fine. I know I'm going to survive. I know my marriage isn't going in the pot. I know I'm not getting fired. But in the moment, it kind of feels like all those things are or could happen.
Right. Exactly. And that's the other thing too. Like for me is because I've had basically like a lifetime of these kinds of challenges that I didn't understand, that the people around me didn't understand. There's a cumulative trauma effect there too, like kind of a complex PTSD. So whenever there's some sort of significant RSD episode, now all of that comes up. So the traumatic component, at least like from my perspective, and I think is probably fairly common in people who are diagnosed with ADHD as adults, makes managing those RSD episodes even more challenging, because then it's like, you know, I flash back to when I'm in kindergarten. Oh, well, Tim can't sit still.
Got it. Okay. So we talked about early on, you're a high performance specialist, and we're going to actually shift the conversation that direction. I want to pick your brain while we got your brain available to us. In a society increasingly focused on, and you hear it all the time, resilience and mental well-being, how can we foster understanding, empathy for those that are experiencing RSD? Like, what would you advise a spouse, a friend, a peer, a manager, when someone brings this to the forefront, or maybe you just recognize some of the things that you're talking about?
I mean, obviously, like with anything mental health related, and I say that like not in kind of the trite way that it's right. used now.
Right.
There, obviously, the education piece is huge, and providing, you know, evidence-based information to whoever it is, in as objective of a manner as possible, I think is probably foundational. From there, then share. So like if it's a first person scenario where, you know, I'm talking with my general manager, I present him the information. I say, okay, now here's how it presents in my own experience. Here's how it presents like when we have these conversations. If it's a, you know, interpersonal, obviously like that's a little bit different, where it's hard to kind of take the emotionality out of those conversations. But that's where timing comes into play. I know, like for my part, so we have a 4-year-old. So the times where we can have adult conversations are obviously few and far between. But if I know that we're going to be in the car together for, 30, 45 minutes, that's when I'll have those conversations with my wife. In the same form, obviously, luckily, like, being married to a psychologist lends itself to being able to talk about those kinds of challenges and things in depth in a way that she obviously, I don't have to necessarily understand. I mean, I don't have to explain things in the same way that I would with a layperson. But I've even had conversations about it with my athletes, and obviously, like, working in professional environments, it's a little bit more collegial than working in the at other levels, at least as far as like what I do. So, sometimes I've had to talk to guys one-on-one. It's like, hey, like, when you said this in this setting, here's how it made me feel. And here's why. Let's try to work through this a little bit together, because like, ultimately, like, we have to work towards the same goal, and we have to do it together. And if we keep having these kinds of interactions that may seem benign, it's going to eventually create a relationship that's not manageable, and people are going to see that. So they're really, really difficult conversations to have with the level of transparency that most people aren't comfortable with.
And from the other side, so your manager, if your spouse was not a psychologist, what tips might you give that person in engaging with someone who you're sensing this might be a thing? I don't want to step on their toes. I don't want to accuse them of anything. I don't want to make them mad at me, but is there a sensitive way to approach the conversation even in the absence of the, I don't want to say diagnosis, but identification of the RSD?
Mm-hmm. Sure. Yeah. I mean, I think being extremely conscientious that the person could take whatever you're saying and magnify it significantly, because there's already going to, and understand, like, okay, if I'm a manager and I understand, okay, I've got a little bit of a negativity bias, I'm always going to lean a little bit in this direction when I receive feedback, when I give feedback. How does it make me feel? Okay, I need to go the other direction when I give feedback to this person to make sure that they feel valued and feel worthy as a person, irrespective of the profession or the professional relationship. And then understand that, like, the feedback that I'm giving you is because I care about you, because I care about you as a person, because I care about your development as a person and as a professional. Now here's the feedback. How can we work together collaboratively so that you understand this isn't a punitive scenario. This is a support scenario. And how can we move forward together with that in mind?
That almost sounds like great advice for any manager, any parent, any spouse, any friend. Like, that just sounds like great advice, period, my friend.
And I wish I probably need to take in some of my own interactions.
Oh my gosh, I love it.
But I think what I would like to hear from people would be that.
Right. Maybe there's a lesson for all of us in that one. All right, let's shift to the high performance stuff. As long as we got your brain working here, your work with athletes, focus on strength, power development, including with endurance athletes. We have a lot of runners, triathletes, cyclists, and others who would fit that endurance category that are listening and probably don't have a power or strength training regimen in their schedule. What would you tell them? They're like, nah, dude, I just need to run more. I just need to bike more. I just need to get in the pool more. Like, what would you say to that person?
How many friends would I make if I told your listeners I was born in Colorado?
Oh, there you go. Nice.
And I was a competitive endurance athlete as well. Nice. So yeah, I was a Cat 1 mountain biker for a long time. So the biggest thing with endurance athletes that I see is like low bone mineral density. So strength training is going to elicit, obviously like a calcium response, skeletally, which is going to improve bone mineral density right away. Not going to have nearly as many stress fractures, or risk or even like regular fractures. And then from a muscular standpoint, like the more, obviously, like the stronger a particular muscle group is, or a particular movement pattern is, the better. So if you take running, for example, quads, hamstrings, calves, glutes get stronger. They're generally going to be able to handle ground reaction forces better. So every time the foot hits the ground, 2.5, 3 times body weight, that force is going back into the body, relatively speaking. So the stronger the athlete is, the better they're going to be able to handle those ground reaction forces, and the more efficiently they were going to be able to use them to continue to run faster, improve running economy, things like that. And then you've got like obviously the other soft tissues, tendons, for example, with running and swimming, for example. You've got biceps tendon issues in the shoulders. You've got quad, patella tendon, Achilles tendon. Probably got some elbow tendon issues with swimmers as well, and cyclists actually. Sit in the aero position for too long. All of those things are going to get a little bit less problematic with some improved stiffness of the tendons. So, when you think about like kind of a spectrum of elasticity, so obviously muscles are most elastic, can absorb the most force. Tendons are the least elastic, but can store force or dissipate force to prevent it from getting to the muscle too quickly. So stiffer tendons are going to transmit force more efficiently into the muscles, which then can use it more efficiently because they're stronger.
Yeah. And I'm hearing voices in the back of my head of people saying, yeah, but it's extra weight and the old 2 seconds per pound per mile. And, I don't want to become super skinny to make up for the added muscle mass and and I think a reminder to them, I'll say it out loud and then you can clarify the details, but folks, it ain't going to happen. Like you're not going to put on 15 pounds of muscle if you add an hour and a half a week of strength training to your routine, but can you enhance that message a little bit more?
Yeah. I mean, like when you think about efficiency, it's doing more with either the same amount. So let's take body mass, for example. If you get stronger, that doesn't necessarily mean that you're adding weight. That means that you're using the weight that you have more efficiently.
Yeah.
And, when it comes to like lean muscle mass, obviously like most endurance athletes are very lean already. But even if you add, 1 or 2 kgs, the likelihood that you lose that economically somewhere else,
right,
in any of your disciplines is super, super low because your body is using its resources more efficiently. So it's a combination of like, obviously musculoskeletal, biomechanical, and bioenergetic, because it's like they all work together synergistically for peak performance.
Yeah, it's very well said. Could you give us, just off the top of your head, some starting points for endurance athletes that say, okay, I got it. I'm in, I'll do something. I can find an extra hour and a half a week. So we're not talking much. We're talking 3 times 30 or 2 times 45. Where would you encourage them to start if they were thinking about that?
I mean, I honestly, like, even if you just do one session, 20 minutes a week, you're probably going to make a significant difference if you don't already have some sort of strength training regimen in place. Yeah, I mean, like minimal effective dose, 3 sets of 5 goblet squats with a kettlebell, at a percentage of body weight. Like I think that's probably another misconception with endurance athletes, that every exercise has to be a certain percentage of like a 1 rep max. And that's a fallacy. Like that's obviously like that's where a lot of the research is, but ultimately it's just like, well, what is progressive overload?
Right.
Okay. Well, if I'm a runner and I weigh 150 pounds, adding 35 pounds and squatting with it is overload. Right. So, if I'm not doing anything right now, starting there, from a practical standpoint, like you want to address kind of the major movement patterns. So, obviously talked about squatting, a hip hinge variation. So like deadlift, but again, not thinking like barbell deadlift, like you're a power lifter. Some sort of upper body pushing exercise, some sort of upper body pulling exercise, some sort of bracing. And again, like probably the most common bracing variation would be a plank, but like ultimately there's not a lot that an endurance athlete is going to get from plank variations. There needs to be some sort of like movement of the limbs, where it challenges the stability of the spine. or like the musculature around the spine. So dead bug variations, bird dog variations, crawling variations are huge. There's a lot of kind of bang for your buck with different crawling variations. And then some sort of like rotation where the hips and the spine kind of dissociate. Hips going one direction, spine going the other. Not necessarily like a Russian twist or anything like that, because there's some like shearing that happens, especially like in the lumbar spine, but more like med ball throw variations where there is some sort of rotation, which is also going to help with coordination as well.
That's a great list. I'm going to ask you for similar advice with a different group that it sounds like from, you said you got married at 38? No, you're 38 now.
39. I was married as, how old was I? 27, 28.
Okay. So you're knocking on 40. I want to shift to the athlete on the backside of 40. We know that all things being equal, we lose about 1% of muscle mass a year after the big 40, but all things don't have to be equal. Someone following what you're talking about. So what advice would you have for the 40 plus? And folks, this applies for you 60 and 70 year olds out there too. But on the backside of 40, let's not let all things be equal. What then do they need to is it the large muscle groups that should be focused on? Is it any tips along those lines?
Yeah. So I always think in terms of large muscle groups working synergistically. So that's why I use the term movement patterns. So if you take a squat, for example, you're going to engage basically like all your muscle groups from the hips down, in addition to like challenging your spine to stabilize itself as well. So that's going to be big. But really, like, I would say it's used the term aging, because it's not, because I'm, like you said, I'm almost 40 now. So like, I think simplification is a big piece. Don't make it too complicated.
Yes.
And make it accessible. So if that means like investing in a kettlebell and a sandbag and a TRX to put in your garage, like do that. So that, you go spend 15 minutes a couple times a week going through a quick routine, but remove whatever barriers to entry may be in place, or whether they're psychological or logistical. And then adequate protein intake, depending on, let's say anywhere from probably 1.2 to 2 grams per kilogram of body weight.
Yeah.
Which, there's going to be hormonal implications there too. So, talking about male athletes, obviously decreasing testosterone, female athletes, all sorts of, progesterone and testosterone imbalances as they get older as well. So making sure that nutritional needs are met foundationally, obviously with protein being a big part of that comes to lean muscle mass, which also plays into hormonal balance as well. I think that's critical.
Yeah, I think that's hugely valuable. We just had Julia Coletta on talking about sarcopenia a few weeks ago, and she got into the scientific, the research side, the lab side of what you're bringing to the forefront in terms of the practical side. Question for you on the protein. So yeah, the 1.2 to 1.6 and maybe slightly higher, as you mentioned, gram per kilogram of body weight is the recommendation. But when people break that down, that's hard. What do you suggest to get for folks that are saying, okay, I keep hearing Brad's guests say you need more protein. How do they get it? Like my routine is basically I do my protein powder in the morning to get about 30, and then I have a protein source on my salad at lunch to get another 30. I eat a snack in the afternoon with some almonds or something to get another 10 or so, and then round it out to get my 100 to 110 at night. But any others, I have to be really in tune to it to barely make it. Any tips for folks that are saying, like, Tim, how do I get that much?
I mean, obviously, like protein supplementation is a kind of a shortcut. If you can tolerate it from a digestive standpoint. I think the other thing is that like look at your other macros and what those ratios look like. One thing that like I do with our guys is we try to periodize their nutrition throughout the week, to where if it's a high training day, they're going to take in, 50 to 55% of their intake as carbohydrates. If it's a recovery day, we're going to flip that, and they're going to be closer to 40 to 45% carbohydrate and a higher percentage of protein, depending on body composition.
On the recovery day, not on the big training day.
Right. Yeah. And and depending on and that's going to be more of like a preseason, and then in season, we may invert that. And they're in the off season right now, so that's going to be even more important. But that's kind of a general formula is if you're on more of a zone 2 day, maybe you take in, the majority of your protein in the morning. And you go, get your 2, 3, 4 hours in, replenish with your normal recovery drink, whatever that is, or meal. And then if it's an interval day, or if it's a more high intensity day, get your carbohydrates in prior to that, and then, support refueling in a normal way. But generally, I think with endurance athletes, those low intensity days probably aren't low enough. As our friend Alan, Cousins
likes to remind us. Yeah.
So, support those days. Well, make sure that you do adequate assessments, whether that's lactate testing or otherwise, understand where that first lactate threshold is, so that without a shadow of a doubt, when I take in X number of calories, they can be at these percentages prior to doing my long run or my long ride. And then I need to refuel with this amount of carbohydrates, this amount of protein, but that you actually have the metabolic testing in place to support utilizing those percentages. Right. But then also obviously you moderate your intensity appropriately as well.
You must be looking over my shoulder, because you just gave us a peek at the question I was planning to ask you next. You've written about zone 1, zone 2 training, the various heart rate zones. We're hearing more and more about you need more zone 1 and zone 2. Can you talk us through, for folks that are going, yeah, I think I've heard that term. I think I've seen something on Twitter about zone 1, zone 2 training. Can you fill us in on what are we talking about here? What does that mean? Why does it matter? What's the impact it has for everyone, for those who are simply wanting to maybe reduce their HRV through better health, to the person who's saying, I want to compete at a higher level? What do you mean I need more zone 1 and zone 2?
So in a typical 5-zone heart rate model, zone 1 is going to be 50 to 60%, at least as far as for example, Polar uses a pretty straightforward 50 to 60, or basically 50 to 100% and 10% intervals. Zone 1, zone 2, zone 2 is 60 to 70%. And I think Garmin is fairly similar for cycling. Running is going to be a little bit different. But essentially zone 2 is, or the top of zone 2 is around 70 to 75% of your max heart rate. And the reason that it's important from a physiological standpoint is, so if you think about the structure of the heart, so you've got all 4 chambers, you got your atria, you got your ventricles. The left ventricle specifically is what pumps blood into the rest of the circulatory system through the aorta. And once you get past that 70 to 75% threshold, again, there's obviously there's a genetic component there too, but so generally speaking, somewhere in that range, the left ventricle stops filling completely, the internal volume of the left ventricle. So when it ejects blood into the rest of the system through the aorta, it doesn't have the full volume that it can per contraction of the heart. So what kind of that zone 1, zone 2, especially zone 2, spending a significant amount of time in those zones consistently versus in more interval based, so kind of in and out of zone 2, is going to ensure that you achieve what's called eccentric left ventricular hypertrophy. So the two kinds of contractions are eccentric and concentric. and hypertrophy meaning like growth of like the muscle fibers. Even within the left ventricle, you've got eccentric hypertrophy, which is improving the internal diameter so that the kind of a stretch or a volume overload of the left ventricle. So if you can imagine like a Bota bag, right? You're basically, you fill it with water, wine, or whatever, and it's going to stretch to contain that volume, and then you squeeze it to get it out. That's exactly what that overload is like. On the other end, you've got concentric hypertrophy, which the result is the same, which is an improvement in cardiac output, or the amount of blood, or the force that it gets into the system. But with concentric hypertrophy, it's more of a pressure overload. So this is what you're going to get when you kind of push a little bit above that tempo pace, or you're working in like long duration, like VO2 intervals, like your 4x4, 4x8 kind of range at 85% of your max heart rate. Again, obviously VO2 is going to be relative, but you still get an improvement in cardiac output. In other words, the stroke volume and the amount of blood per beat is going to improve, but the internal diameter of the left ventricle is not going to increase. It's actually going to decrease. So resting heart rate increases as a result of that, even though the efficiency of the heart maybe improves. With the eccentric left ventricular hypertrophy, resting heart rate goes down. Working heart rate at the same intensity decreases as well, which then as you increase intensity, you're utilizing the efficiency of the heart more, like that's just better in general.
That's as well as anybody's ever described it on here. And we've had a lot of people describe it. So nice job. That makes so much sense. So you're not filling that left ventricle entirely when you're doing those intervals, when you're doing that tempo run. You need the Z1, Z2 to prep the system, to prepare it so that you can maximize those efforts.
Right. And so basically you've got two ends of the continuum. So adaptations at the heart level are central adaptations. Adaptations in the rest of the system are peripheral adaptations. Periphery, you've got improved capillarization, so new capillary beds, improved density, more capillaries, as well as like the actual size of the capillaries increases. And then at the cellular level, you build new mitochondria, you develop aerobic enzymes to deal with lactate, pyruvate, some of the waste products that are produced in the cell. But then with a more efficient, like actual heart muscle, blood goes through the whole system, oxygen gets into the cells can turn over the lactate and the pyruvate and hydrogen ions faster, bring the lactate back into the bloodstream, process it through the liver, use it as a fuel source at lower intensities. So it all works together synergistically, both the central adaptations, the peripheral adaptations. At higher intensities is where a lot of the peripheral adaptations happen, which are great from obviously like a power production standpoint and a performance perspective. But in terms of like actually facilitating the whole process, you need both. And Alan's going to get mad that I said central and peripheral adaptations because
that's all right. Oh, okay. So that's super helpful. I don't want to let us get off of this one without helping folks understand max heart rate, because a lot of them are hearing, well, 220 minus your age. And we're like, no. Oof. So what would you suggest? You go out and run a 400 and really hammer that last 100 meters coming down the straightaway and see what it ends up being? What's your suggestion for people to try to get somewhere in the ballpark? You're probably not going to hit your true exact max, but how can they get within 2-3 beats of that thing? Without a lab test?
I think depending on the discipline, I would say obviously if you're strictly a runner, obviously you want to use some sort of running assessment. I would do like an 8 to 10 minute easy warm up, and then 2 minutes really, really hard, couple minutes easy, 2 minutes really, really hard again. And probably do that for about 20 minutes cumulatively. So like 2 minutes on, 1 minute off. And then in that last interval you'll probably get pretty close to your max heart rate.
Okay.
For cyclists, I would probably do like a Carmichael test.
Okay.
So 10-minute warm up, 8-minute time trial.
That's good. There's a lot more I want to ask you, but let's just wrap it up with one more. What some of the biggest lessons you've learned? Pick out one or two that come to the forefront in terms of surprise to you as you've advanced in your career, as you've studied, if you've worked with these athletes. What are one or two of the surprises that you thought, well, we didn't get that in school, or I didn't expect to see that come out of the research, or any of those kinds of things that pop into your head that might be a surprise for folks that aren't doing what you and I are doing, of spending our days reading research and working with folks in the real world?
Big question. I think the biggest thing is the communication piece. I think obviously being in these professions, it's easy for us to go really, really deep on physiology, on periodization, on all of the practical components, but really like none of that matters if we don't have really, really good communication skills. And a lot of that, like going back to the RSD conversation, understanding yourself for one thing. And I was actually having a very similar conversation with one of my business partners earlier today. A lot of people purport to be authentic and without really having a strong sense of identity, like understanding really on a deep level who they are.
Wow.
For any number of reasons, right? But knowing yourself really, really well, knowing your strengths, weaknesses, et cetera, will help you as a practitioner build better rapport, build better relationships with your athletes, so that all of the physiology, all the periodization, all the practical stuff is enhanced because you've built that relationship with the athlete or the athletes that you're working with. But obviously, like, that requires a lot of internal work, and then it requires a lot of external work.
Yeah.
From a relationship standpoint.
Yeah. Tim, awesome job, man. Really appreciate it. And again, thank you for your willingness to do this. We traded some texts and stuff for a couple of months, and you're like, okay, now I think I'm ready. Thank you for putting yourself out there. And you just shared so many things that I wasn't familiar with before. And I'm sure I'm not alone, and apply to all, like we talked about, this approach that you said would be really helpful here. I hear it as, wow, that would have made me a better parent. That would make me a better supervisor. So thank you. We really, really appreciate it. Thanks for putting yourself out there and being willing to share some of these struggles and your journey along the way.
I appreciate you inviting me. Great questions.
Absolutely. Take care, buddy.
Hi, Brad.
Thank you, Tim. Your willingness to share your journey is very much appreciated, and I think will really make a difference out there. A reminder to employers, benefit consultants, and complementary wellness providers, Catalyst Coaching 360 not only offers coaching to support the physical and mental well-being of those you serve, they also have access to Catalyst Elite, our high-performance coaching for those with big goals on the horizon, either personally or professionally. Feel free to reach out anytime to discuss details, results at catalystcoaching360.com, or visit the website catalystcoaching360.com anytime. And now it's time to be a catalyst. This is Catalyst Coaching 360's Dr. Brad Cooper. Make it a great rest of your week, and I'll speak with you soon on the next episode of the Catalyst 360 podcast, or maybe over on the YouTube coaching channel.